Hey guys, I'm gonna be uploading the video tonight. So I end up purchasing the land. I'm gonna be building a house on this vacant land, uh, and that's what I've been busy in. The point of making the video here while I was visiting the land is to make a point that um, it, preparing this land and working with the contractors and other things required an extreme amount of agility, walking, and other things on my behalf, on my part. And leg lengthening, it's another thing that, although it's not a sport, I'm not playing a sport, but the daily lives challenges that I have to put up with because preparing the land, I'm easily able to do so. So I don't feel handicapped. I don't feel like I'm not able to do certain things. I'm actually able to perform normally and without any issues. So that's another feedback for you guys. If you're thinking how leg lengthening affects the daily grind. So, okay. So the first question is, I'm planning to do this surgery in 2 years. And my biggest question is, do you eventually forget your old height? Or are you your old height in your mind forever? And does your friends and family eventually forget, or will they always bring it up? Let's say you meet a new girl in front of them, would they bring it up? That's a really thoughtful question, and there are a few layers to it. First, about whether you eventually forget your old height. So from my experience, our minds are incredibly adaptive. When I was in the middle of leg lengthening process, or even before the surgery, it felt like height was a huge part of my identity. But now that I'm fully recovered, I actually find it hard to recall exactly what my old height was like. It is similar to how people adjust to a new look after LASIK or significant weight loss. Over time, your brain starts to treat the new height as your normal and pushes the old memory into the background, helping you live in the present rather than constantly comparing. As humans, we tend to live relative to others. Pre-surgery, I would often compare myself to those taller than me because I was the shortest in my group of friends. And that made me the target of height-related jokes. But after leg lengthening, something changed. Since I was not the shortest anymore, the jokes stopped. And their attention shifted elsewhere. And it's not something that they did deliberately. It's just something happened. I mean, I had to notice, like, hey, nobody joked about it anymore. Socially, people tend to focus on what's most noticeable in a group. And once that marker disappears, that whatever distinguishes you from the other, it's like their focus just naturally moves on. So to answer your question, I have noticed that within the circle of my friends, height has not come up, not at least about me. About others, they may have joked, but not with me. So it is also worth mentioning that while your physical height changes, your confidence may take some time to fully adapt. I have noticed it with people who have undergone weight loss and they reach their goal, but sometimes still carry the confidence of their before self. The same can happen with height. Mentally, it may take time for you to feel taller. Even though you know you're taller, but with time and daily life experiences, that confidence gradually aligns with your new reality. So it may take some time. As for friends and family, they might mention your height change early on. In early days, your friends and family may talk about your height just because it's new, but
like any other transformation, once it becomes your norm, they will adapt and they will stop bringing it up. Kind of like, if somebody had, what's that process? The Invisalign. Initially when you had an Invisalign, I mean, when you have told your friends, they may bring it up like, look how good his teeth look. But gradually it becomes old news and nobody brings it up. The funny thing about social circles is that people adjust quickly, and pretty soon your height will feel as normal to them as it does to you. In my eyes, successful milestone is when you are confident enough that when you meet your new people, you don't even think about the height or feel like you have to tell them. And that's the case with me. I have met many, many friends, many, many people, and none of them, neither they brought height up nor that I spoke about, because to them, I'm me. I mean, that's the me that they're looking at from day one. My new height is a normal to them. Going back to family and friends aspect, one thing I have observed is that while most family and friends, family members will adjust and eventually accept your new height, there may be some who will react with a bit of jealousy. And sometimes some people may feel a bit envious if they can't afford the surgery themselves. So if they can't afford the surgery themselves, there's nothing they can do for themselves. Or if they see a positive change in you, but they don't have similar experience, it's like they would call the sour grapes. Some people might downplay or even criticize the change as a way to cope with their own feelings. I have noticed that with a couple of people. It's like they are angry at themselves that, if you're trying to lose weight and here comes your buddy who has lost weight and looks good, and if you feel like there's no way you have that discipline to lose as much weight, being angry or envious, jealous is a human response. So I'm just saying that may or may not happen to you, but there may be segment of people who would never be okay with your new height. They would always either bring it up or say some snarky comment, for example, like, hey, I used to know you when you were shorter, or anything like that. So that's completely fine. The best thing you can do is ignore them and just move on. The lesson here is that not everyone will be happy or supportive, and that's okay. What's important is not letting those attitudes affect you. Focusing on your own happiness and confidence is what matters most. And when you embrace your own journey without expecting validation from everyone, it allows you to fully enjoy the positive changes and move forward with confidence. So overall, while the physical change of leg lengthening is significant, the mental and social adjustments happens gradually until you and those around you will eventually stop seeing it as anything out of the ordinary. You will have to adjust to it, and eventually it will become normal. So hopefully that gave you some idea and answer your question. Let's see, what's the next? All right, the next question is, I am 55 years old. Do you think I am too old for this? Okay. This question usually comes from fear of not healing. I mean, at the base of this question, I feel, is the fear of not healing. Age is definitely a consideration, but I don't think 55 is too old for leg lengthening surgery, especially if you're in a good health. To put in perspective, knee and hip replacement surgeries are commonly performed on older patients, and they typically heal quite well. And just to be clear, I do not look at hip or knee replacement surgeries lightly. As you know, They involve removing damaged joint and replacing them with artificial implants, which requires precision and a significant recovery period. So these procedures also involved physical therapy, much like leg lengthening. So I don't think it's the matter of age, but your overall health. As long as there aren't any significant comorbidities or underlying health issues, it's entirely possible to undergo leg lengthening later in life. You just have to ask yourself, do you have any other conditions, any comorbidities? Do you smoke? Do you have follow a proper diet? Any issues like osteoporosis? The key is to maintain a good level of health and be prepared to commit to a rehabilitation process. So with the right mindset, care, I don't think age matters, or age doesn't have to be a barrier. The other question is, what medical conditions do you think should be kept in mind for the surgery? This question goes hand in hand with 55-year-old. That is, the older you are, is it more dangerous? I think the medical conditions are the ones which matter most. So before considering leg lengthening surgery, it's important to evaluate certain medical conditions that could impact your ability to undergo the procedure or recover effectively. So here are some conditions that I compiled. So one is osteoporosis or other bone health issues. So weak or brittle bones can complicate surgery and healing process. So it's important to ensure that your bone density is sufficient for the procedure. If you never had any bone problems, any pains, any osteoporosis symptoms, chances are that you're probably okay, but it's better to ask the doctor. The second is the cardiovascular conditions, heart conditions. So heart disease or other cardiovascular issues could increase the risk associated with surgery and anesthesia, things like high blood pressure and high cholesterol. The reason I bring that up is because a lot of questions I receive, I noticed either is they're from Asia, either it's from India, Nepal, China, Pakistan, Sri Lanka, all of that area. So I have noticed that as Asians, the high cholesterol is very, very common. The question is with high cholesterol, do you also have a heart disease? If you have these kind of conditions, there may be some extra tests that you may want to do or want to ask the doctor, would my conditions interfere with any bone healing? Number 3, diabetes. So poorly controlled diabetes can impair healing and increase the risk of infections post-surgery, which is why you notice that people with diabetes, they have to pay extra attention to, if they get hurt or they break their bones, because their wounds heal slowly. So diabetes can affect healing. Number 4, blood clotting disorders. So condition like deep vein thrombosis, DVT, or a history of blood clots could increase the risk of complications during and after surgery. I think pre-surgery checklist includes DVT testing. They do test your blood, so it should be accounted for. Number 5, autoimmune diseases, conditions like rheumatoid arthritis or lupus may affect the healing process, and it could also increase your risk of complications. Number 6, nerve disorders or neuropathy. Any condition that affects your nerves could complicate both surgery and your recovery. Number 7, chronic infections or immune system issues. A compromised immune system can lead to increased risk of infection or slow recovery. Number 8, which is more important, obesity. So being significantly overweight can add stress to the bones and joints, complicating both surgery and rehabilitation process. If you're overly obese, it may be a good idea to pay attention that the nail or screws and stuff you're getting, are they up to your weight limit? Or are you at risk of breaking them? Number 9, mental health conditions. So since the recovery process can be a lengthy and challenging, conditions like severe depression or anxiety should be considered as they could impact your ability to cope with the demands of the recovery. This is a true story. So right after I had my leg lengthening surgery, so after you go home in leg lengthening, there's a phase come in when you start to go to outpatient therapy. So in my batch, there were 3 of us, 3 patients. One of them couldn't take it anymore. So it was 2 weeks after surgery. I'm talking 14 days. It was during the therapy. He said he couldn't take it anymore. So it was like second or third therapy session. And he said, I can't take it. So, and later I heard that he opted for reversing that process. Didn't want to lengthen. He wants those rods out. And then they would have treated his bone as, put a cast on. They would have treated his condition as he broke his bones, basically. So that tells you mentally, if you're not prepared and strong, you could have a panic attack. You could freak out. What else? Number 10, nicotine use. So although this is not a medical condition, but you have to watch out if you are a heavy nicotine user, because nicotine causes blood vessels to constrict, narrowing of the blood vessels, which reduces blood flow to surgical sites. Adequate blood flow is essential for delivering nutrients and oxygen necessary for healing, and reduced blood flow can lead to slower healing, actually it can increase your scarring as well, wherever they cut, and higher risk of wound complications. So if you're a nicotine user, you're a heavy smoker, you want to cut down like at least 6 months before surgery. What else? I think for surgeries like leg lengthening, where bone growth and healing are crucial, we talked about smoking and nicotine, but anything you're doing which may complicate bone healing, you want to pay attention to. So these are the main conditions that I thought you may have to pay attention to. Okay, another question is, I heard that it is hard to squat and sit down initially and without practice. Is it just a mental block that prevented you from doing so? Okay, so they're asking that they have heard that it's very hard to sit down on the floor initially, but is it just a mental block or you literally can't physically do it? Okay, so it is true that squatting and sitting down can be challenging initially after leg lengthening surgery. It is not just a mental block. It's more about the physical changes in your body, the physical changes your body has undergone. Think of it like a ballerina lifting their leg vertically or doing a perfect split. For most people, this seems impossible without practice. It requires dedication and regular stretching to achieve such flexibility. Similarly, leg lengthening surgery tightens the muscle, nerves, and tendons significantly. To regain the normal function and flexibility, it is essential to engage in a consistent stretching and practice. And with time and effort, these movements become easier, but it definitely takes some time and patience and perseverance. Okay, the other question is, do you feel your body is back to normal? Absolutely. I feel like my body's back to normal. I'm not an athlete, but I have many activities that are important to me, such as walking. When I say walking, I mean extreme distances, like, a couple of miles every day, farming, running, and car maintenance. I have 3 cars. I change my own oil, which involves a lot of squatting. And right after surgery, I wasn't able to do any of these activities. However, with physical therapy and daily stretching, I gradually regained my abilities. I mean, you saw in the beginning of this video, I was on the property that we're going to be building the home, and it requires a lot of walking, a lot of work, planting trees, digging. So all of that I would not have been able to do had I not functioning at an optimal level. I walk a lot. We go to a lot of zoos, aquariums, hikes in parks. I also run on treadmill. Squatting is easy. I'm easily able to sit down on the floor. Like I said, I changed my car oil myself. I have been doing that for past year, and it's become normal the way it was before surgery. I would say it's truly amazing how quickly the body adapts to the new norm, including the newfound height. While there are challenges in the beginning, the body's ability to adapt is incredible. And with time, most aspects of life return to a comfortable rhythm. So if you continue at it, continue with your therapy, I think you'll be fine. I heard it was most painful right after you wake up because they broke your legs and you have nails in them. How come you didn't have any pain at all when first waking up? Okay. So that, and the second question is the very same. The second question is, how did it feel when you first woke up from surgery? Were you in excruciating pain? Did they put you under anesthesia with an IV or a gas mask? Okay. So it is quite common concern to think that waking up after leg lengthening surgery would be extremely painful, especially since the procedure involves breaking of bones and inserting nails. However, I was surprised to find that I didn't experience any pain when I first woke up from surgery. The reason for that is due to the pain management protocols that they have in place. This is not specific to the Sinai Hospital, but any hospital in the United States, they want to make sure that you're comfortable. So just like any major surgery, I was given pain medication that effectively controlled any discomfort. These medications are carefully administered to ensure that the patients are as comfortable as possible during the initial recovery period. It is similar to what happens when someone accidentally breaks a bone and gets a cast. Once the bone is immobilized and proper treatment is in place, the constant pain subsides. You know how if you do break, let's say you break your arm, and if you keep your arm in the same place, you put a cast on, the pain dissipates. You're not constantly going like, oh my God, that extreme pain has gone away. Leg lengthening is the same way. They keep them in place because of the nails, the rods. So in the leg lengthening case, the bones are stabilized with nails and the pain is managed through medication and care from the medical team. And you can compare the experience to somebody waking up after a hip replacement. Like in leg lengthening surgery, hip replacement patients often wake up with minimal pain due to effective pain control. So while the thought of waking up with a broken bone might sound daunting, modern pain management techniques are very effective at minimizing discomfort and making the recovery process more manageable. And second question was how I felt waking up. Okay, so number one, grogginess and disorientation. Like with most surgeries, the first sensation when waking up is usually a bit of grogginess and disorientation due to anesthesia. It might take few moments to fully realize where you are and what just happened. Second is a sense of relief, many patients, myself included, feel a sense of relief upon waking up, knowing that the surgery is over and it went as planned. And this can be a comforting moment, even if you're still a bit drowsy. Number three, lack of immediate pain. As mentioned earlier, One of the surprising things is the lack of immediate pain, thanks to the effective pain management protocols. It is actually not common to wake up and feel numb in the areas where surgery was performed, because they would have, given you injections and stuff on the site of the cuts. Number 4, heightened awareness of new reality. So there's often a sense of heightened awareness, knowing that the journey towards the new height has begun. It's a mix of euphoria, excitement, and curiosity about the next steps in your journey. You're happy, and you keep telling yourself, like, oh my God, I finally did it. Like, this is it. Like, all those fantasies, daydreamings, and your thoughts that you said one day you're going to do the surgery, they just come in flooding in, and you're kind of thinking like, okay, now what's next? How I'm going to, so you're kind of more happy about it, And number 5, supportive medical team. So upon waking up, you are usually surrounded by a supportive medical team who immediately checks on your condition and makes sure that you're comfortable. This helps create reassuring environment as you come out of anesthesia. The first thing I remember after the nurses was that Dr. Asia came to visit me, checked everything, looked good, and boom, we moved on. All right. The other question is, I heard that limb lengthening surgery could lead to heart issues since the arteries and blood vessels in the leg are connected to the heart and can cause pulmonary embolism. Can you please let us know if that's true and how a patient and a doctor can avoid it? Okay. Limb lengthening, the truth is that the limb lengthening surgery does involve some risks, and it is true that any major surgery on legs could potentially lead to complications that affect the heart and circulatory system, including the risk of PE or pulmonary embolism. However, it is important to understand the context and how these risks are managed. So let's go to PE, pulmonary embolism. It is a condition where a blood clot, often originating in the deep veins of the legs, deep vein thrombosis or DVT, travels to lungs and causes a blockage. So this can indeed be a serious complication, but it's not unique to limb lengthening surgery. It can happen to any surgery, particularly those involving the lower extremities or lower limbs. To mitigate these risks, both patient and doctor can take several important steps. Number 1, perioperative assessment. Pre-surgery, before surgery, your doctor will assess your overall health, including your cardiovascular system, to ensure that you are a good candidate for the procedure. This might include evaluating your risk for blood clotting, such as history of DVT, smoking, obesity, and certain medical conditions. Second, anticoagulants. So after surgery, patients are often prescribed blood thinners. So blood thinning medications, which are anticoagulants, to help prevent the formation of blood clots. All right. The other device is compression devices. So during and after surgery, compression socks or stockings or devices may be used to keep blood flowing in the legs and reduce the risk of clots forming. They just contract and expand, and they keep your legs basically mobile. Number 4, early mobilization. So one of the best ways to prevent DVT and PE is to start moving as soon as possible, as soon as it is safe to do. Physical therapy is a key part of recovery process after limb lengthening surgery, and getting up and walking as early as possible can significantly reduce the risk of complications. And number 5, regular monitoring. So post-surgery, your doctor hopefully will monitor you very closely for any signs of complications, including issues related to heart and lungs. Any symptoms like shortness of breath, chest pain, or swelling in the legs should be reported immediately. I mean, when you're going to wake up, initial days, of course, you're going to have swelling in your legs. But once you have healed or you started to heal, if you start to get a lot of swelling in your legs, that should be reported immediately. So while the risk of DVT and PE are real, they're well understood and can be effectively managed with proper care and precautions. By following your doctor's advice and sticking to the recommended post-operative care plan, you can significantly reduce these risks. Okay, the other question is, I am thinking to go to China for this process. What are some of the things to consider? Okay. Considering leg lengthening surgery in China is an option that some people explore due to significantly lower costs compared to the United States. However, there are several important factors to keep in mind before making this decision. First, while the cost of surgery in China might be much, much cheaper, you have to factor in the long travel time and the challenges it will bring. Traveling such a long distance can be exhausting, and in the event of complications, it could mean having to stay in China longer than anticipated. Extended stay could quickly increase your overall expenses, even higher than the United States, potentially offsetting the initial savings from the surgery. Another crucial consideration is the quality of care. The standard of medical facilities, the experience of surgeons, and the level of post-operative care can vary widely throughout the world. It is essential to thoroughly research the clinic and the surgeon you're considering, including their credentials, experience, and reviews from previous patients. It's also a good idea to ensure that the facility is internationally accredited and adheres to global standards of care. Now, don't forget the recent case, a very, very sad incident of that guy who ended his life, Matthew Latour, I think from France, maybe. He traveled to Istanbul, Turkey for a beard transplant procedure, and he was left with the horrible scarring and a patchwork of a beard. And he later learned that the man who performed the procedure on him was allegedly not even a medical professional. The guy posing as a medical professional was a realtor, I believe, in the news article. So this lack of accountability is what scares me the most. In U.S., yes, it's true that our cost of care is high, but the red tape to prevent this kind of thing happening is also present, So additionally, consider the potential language barrier and the cultural differences, which could complicate communication with your medical team and affect your overall experience. You should your access to follow-up care once you return to the United States is another key concern. If any issues arise after your return, you may find it challenging to get the same level of care and expertise locally, which could lead to further complications. So, basically, you have gotten the procedure in China, and if you don't want to stay there for 2-3 months, you come back to the States, and let's say you have any complication, either you're going to have to find a doctor locally and consult, or you're going to have to go back. Air travel is another important consideration, particularly when thinking about leg lengthening surgery in a far-off location like China. Long flights, such as those between U.S. and China, can pose additional risks, especially when it comes to blood clots. I was talking about DVT. Well, in this case, sitting for extended periods in a cramped position it can increase the chances of developing deep vein thrombosis, which can lead to serious complications like pulmonary embolism. And after leg lengthening surgery, you will be at high risk of blood clots due to changes in your legs and reduced mobility anyway. So the long duration of the flight combined with the need need to sit for many hours could exacerbate the risk. So it is crucial to discuss this concern with your surgeon before planning your travel. Some potential strategies to mitigate this risk, if you must have it in China, include wearing compression stockings, doing regular leg exercises during the flight, staying hydrated, and possibly using blood thinner medications as prescribed by your doctor. In summary, I would say that while the cost savings are present in China and they can be appealing, it is vital to weigh these against the potential risks, the quality of care, and the logistical challenges involved. A well-researched decision with a thorough understanding of the pros and cons will help you make the best choice for your situation. All right, let's see if I have any more questions. Nope. So hopefully these were helpful. These answers were helpful to you guys. I was thinking the other day after the election, the United States elections, that hopefully some of you were holding the Bitcoin, that it is going crazy up, that maybe it has enabled some of you to be able to afford this surgery. I do hope that the surgery will slowly become, if not cheaper, at least a little bit lower so that it is affordable for a lot of people. At the end, I would say still, I'm thankful that I got this procedure done, and I'm thankful for Dr. Asiag. So shout out to all the surgeons who are doing a good job in providing the services. So, all right, guys, until next time, take care. Keep sending the questions. I'll try my best to answer. Like I said, building a house, packing, working, but I know that how important these things are for you guys, those who are still thinking about the surgery. So stay tuned, and please forgive my increased absences. So thank you. Bye.